Hey there, sunshines. My name is Stephanie Burrow and welcome to my channel. In today's video, I'm going to be talking about my Diep Flap reconstruction surgery. I did a video a month ago on what is a Diep Flap reconstruction surgery. This video is going to entail what I'm going through as of yet. I have only a few days before my surgery, and so just to give you some details of what to look for, what I'm experiencing as I prepare myself. And I want to share as much as I can, because when I try to look on YouTube to see what can I prepare myself for this surgery, there was limited information out there. And so I want to, but it's going to depend on how I feel. I want to say that right now, but in the process of going through the pain and the recovery and being just unavailable, I may not be able to do it, but hopefully I'm in a position where I can give you just a little insight what to expect after surgery. But to talk about what I have been doing, there is a pre-admission operation appointment that you make with your plastic surgeon and your doctor. And I did that, and I got my instructions on what I need to do pre-operation and post-operation. And I must say that is very intense. This is a very invasive surgery, and it kind of made me nervous. So I just want to share some of the points that was told to me and what you can look for, or a loved one can look for, when they are faced with this situation. So I'm not going to give you details of what's involved with the Diep Flap surgery. I did that in my other video. So if you want information about exactly what's entailed in having a Diep Flap reconstruction, I suggest that you watch my video on what is a Diep Flap. I even have little graphics there that you can get an idea of what's involved in the Diep Flap surgery. This video is for what you need to do to prepare for the surgery and what to expect after post-operation. And so one thing I was told that I was going to need is a walker. I'm not going to be able to stand up and walk straight like normal. So I'm going to be scooped over. And so I'm going to have to use a walker. I don't know how long, but as long as I need to, I guess I will be. And then I'm not going to be able to sleep in a bed. So what they did was they gave me a list of different rental companies, medical rental companies, that has a lift chair, because it's going to be hard to sit down and to get up, because you're going to be using those muscles and the muscles that they're going to be cutting into. So having a lift chair, which I kind of figured on my own, so I already was doing my research on getting one. But once I went to the pre-operation appointment, they did tell me that's something that's required. The doctor wants me to sleep in a recliner, a lift recliner chair. And it's the one that lifts you all the way up to like you're standing. And so you want to put so much pressure on your wounds. And so I did order that. So that's coming in the day before my surgery. And you also going to need comfortable clothes. And because you're going to be having JP drains, maybe I'm saying a little bit too much, but look it up what JP drains are. So you're going to need something that can be comfortable. So I'm not going to be able to raise my hand up. So my gown is going to have to be buttoned down. So if you are planning on having surgery like this, for you to be comfortable, make sure you get a buttoned down gown. And so it's just comfortable, it's easy, and you don't have to use those muscles that's going to be pretty much contracted and intact at the time being, temporary. And there are a few other things that I did write down because I knew I was going to forget, because this is random. But the recovery will require having a care plan. That is so important. This is not something you can do by yourself with this surgery. You're going to need someone to be there to care for you. It's going to be a lot of things, a lot of range of motions you're going to need someone to help you with. Getting up, going to the restroom. You're not going to be able to shower yourself, so you're going to need help with that. So having a care plan or someone there to help you with those things is so important. And me being in the medical field for years, knowing that I have a team of 3 caregivers that's going to come in to assist me in some of the daily tasks that I would need throughout the day. And so we had this plan last year. And so I'm just fortunate to have a great team of friends who are going to do that for me. Coming home for that first night from the hospital after surgery is going to be one of the toughest nights you're going to have. I remember last year when I had my operation last year, my double mastectomy, it was rough that first night. And I didn't have anyone but my mom. But I was so sick, and so someone had to rush over and come and stay that first night. So that first night was a little rough coming home. So I anticipating that this time it would be, but I'm privileged to have one of my friends come that's going to stay with me. So she volunteered to stay that first night with me, so which I consider a blessing. I just told her, be prepared for me to cry like a baby if I'm in pain. But the doctor also will give you the medicines that you need to calm down the pain. So different medicines. And so they reassure me that yes, this is rough, but when you think about the outcome of this journey going through cancer, I'm almost at the end of this journey. And so that's the wonderful thing about it. And I just got to keep my mind focused on that okay, yes, I have to go through this terrible surgery, but I'm almost at the end of this marathon. So it wasn't a sprint. It's taken over a year, and I still have to recover from that. And it's just the outcome is what I'm looking forward to. I had a privilege with my doctor to see some pictures of some cancer patients that have gone through the Diep Flap surgery, and to see what to look forward to. And beautiful work. The work was beautiful. I felt so satisfied with her doing the surgery. And so I do have something to look forward to when it's all over, said and done. I will feel comfortable, and it's just amazing what they do. And as a cancer treatment, with all the teams getting together and being able to help breast cancer patients to feel normal. It's just amazing what they do. And I'm just looking forward to the outcome. The outcome is going to be beautiful, and I'm planning on working hard to make sure I keep myself healthy, get my body in shape, and just moving forward from this. And I'm going to be displaying some of that on this channel too, just to see the journey, so you can see the journey. It's a journey, and once I start videotaping and blogging, it's going to hold me accountable, because sometimes you can get laxed and comfortable, but cancer really hit me and just woke me up to what I need to do for myself, for my health, and I want to share it. And I just want to give you an update. I have 3 more days to go before my surgery, and I just hoping for the best and keeping positive. I didn't lose the 13 pounds that I was trying to lose in my 30-day challenge, but I got very close. I was 4 pounds shy of my goal. So the was 4 pounds. So I know that after the surgery, I will be hitting hard on my health journey. So I want to say thank you for watching my channel. Be on the lookout for more videos. Hopefully I can give you a little inside scoop on what happens post-operation. That's my goal. And if not, I will see you on the other side where I'm healthy. I'm going to be cooking and exercising and just giving you inspiration if I can, encouragement. And hopefully this video or this channel can touch someone who's going through cancer or going through life after cancer. So thank you for watching my channel, and I see you in the next video.